big difference in the political climate and affairs between the U.S. and the European Union is the outcome of the recent leadership elections, as you all well know. You have Ursula von der Leyen. I've heard other ways of expressing her name. And we have Donald Trump and his close ally, Robert F. Kennedy Jr. Bobby tours all over the nation. People don't realize it. He's constantly shuttling to state governments to get them involved in this entire initiative. This would be akin to, if you could even bend your mind around it, Ursula going out to the member states of the European Union and talking to them about how the council could work better with the member states to promote health. Is that even a possibility? Okay, let's see if that's something that can be replicated in the European Union. Almost all of our federal agencies have a dual mandate, and it's illustrated really clear in the CDC for vaccines. The CDC has a mandate to promote vaccination, and they also have a mandate to monitor safety and effectiveness of vaccines. Which budget is bigger? Promoting vaccination is way bigger, okay? So you can figure out what's happened there in the dynamic. The culture of the CDC has become really wrapped around the idea that any information which will cause the listener, the recipient, to become vaccine hesitant must be suppressed. Whether it's true or false, it cannot be shared. Okay, then this is spread across the world. In some ways, I think we may be the source. Like many U.S. federal agencies, the CDC suffers from conflicting mandates. In the case of vaccines, it's tasked with gathering information on safety and effectiveness, but also with promoting vaccines and vaccination. As I mentioned, there's been more of an emphasis on promoting vaccination. This has pervaded the entire medical services sector under the leadership of CDC and their marketing. It's pervaded the entire medical services sector to the point that any attempt to objectively and rigorously evaluate vaccine safety and efficacy is regarded as a systemic cultural threat to public health. If you ask the question, you are a threat to public health. That's the logic. The interests and culture of public health and those of the vaccine industry have become one and the same. They're inseparable, and they're not allowed to be questioned. This is a fundamental. The Overton window, if you're familiar with that concept, of acceptable public discourse concerning vaccines is closed, with layers of gatekeepers in corporate media, academia, medical guilds, industry marketing, scientific journals, and political parties all focused on preventing any objective scientific evaluation of vaccine risks and benefits. This is justified based on the thesis that any information concerning vaccine risks will lead to vaccine hesitancy. Vaccine hesitancy will then cost lives. The CDC has become the primary governmental enforcer of this logic, to the point of sponsoring social media gang stalking campaigns targeting dissenters. I'm sure Asim has been on the receiving end of those gang stalking campaigns on social media. During the Biden administration, the federal security apparatus and the intelligence community, this is all documented. Federal security apparatus and the intelligence community cooperated with the CDC to monitor and censor all who challenged or violated this cult-like belief system. Same thing happened in the UK. The accepted official position became that any who questioned any aspect of promoted vaccine safety and effectiveness narratives were killing people. Those who transgress were literally and figuratively accused of being mass murderers by press as well as CDC-sponsored and facilitated activists. Those seeking to take my medical license, they failed, during the COVID period, literally accused me to my medical board of being a mass murderer for publicly discussing the risks of mRNA products. Here is one example illustrating the perverse logic that has enabled this cult of vaccination. According to evidence-based medicine, the, quote, best available evidence should guide clinical decisions. You agree? Retrospective studies have emerged showing vaccinated kids are much sicker, but these studies are always dismissed by the, quote, vaccine experts in the mainstream media for not being, quote, well controlled. Here's the logic trap that powers that. Since placebo trials on vaccines are never done for, quote, ethical reasons, by the rules of evidence-based medicine, the retrospective studies we have are the best available evidence. And their conclusions about vaccine harm cannot be dismissed unless better, ergo placebo-controlled trials, are conducted to corroborate or refute them. And by the way, that's part of Bobby's initiative with the CDC, is to empower true placebo-controlled trials, not only of individual vaccines, but of vaccine-vaccine interactions, for which there are no studies. When you're giving multiple vaccines to your child, what are the data showing that those vaccines are not going to interact? If it's a normal drug-drug interaction, the FDA is all over it. If it's a vaccine-vaccine interaction, crickets. Studies not done. Studies are basically considered to be impossible, unethical. Those data should not be obtained. The alternative vaccine safety advocacy community's perspective, in other words, those that are advocating in the alternative community for vaccine safety, is that the actual reason these placebo trials are never done is because they would immediately show how dangerous the vaccines are. Hence why the vaccine industry has to constantly make excuses for not doing them, while simultaneously claiming if they were done, they would show that vaccines are harmless. They, talk about cognitive dissonance. In this space, it's okay to have clear cognitive dissonance and illogic if in the service of promoting vaccines. In short, anytime someone critiques a retrospective study comparing vaccinated to unvaccinated as invalid, it's critical to remember that these studies are the gold standard because better ones will never and can never be done due to promoted, contrived, and tenuous ethical considerations that are not allowed to be questioned. And meanwhile, back at the ranch, the profitability of the vaccine industry has soared to new heights. But all drugs, including vaccines, have risks and benefits. All drugs should be judiciously prescribed for those that are more likely to benefit from treatment than to be harmed. And free citizens, in theory, what we have here in the European Union and the United States, free citizens have the right to understand those risks and benefits, do they not? And to determine if the potential benefits outweigh the risks for themselves as individuals. This is particularly true with prophylactic vaccines. Think about it. This is a fundamental principle in vaccinology. Prophylactic vaccines are administered to otherwise healthy persons with the intention of preventing an unpredictable event that may or may not occur, infection and subsequent disease, at some point in the future. Out of all drugs, vaccines must be the most safe that they can be because they're given to healthy people. Healthy people that you cannot predict if they are going to become unhealthy at some point. So they darn well better be safe. This is a fundamental principle of vaccinology, pounded into me over 30 years of experience and training in clinical research. And yet we completely disregard this because it's inconvenient. To probe how far this has gone with American culture, I recently posted 2 simple questions on X, both of which were read by over 200,000 people and provoked thousands of comments. About a third of those comments were attacks that would meet European standards for hate speech. Here's the 2 simple questions. Can we at least agree that it would be good to have safer and more effective vaccines that are rigorously tested according to established modern regulatory standards? Apparently, that is a really controversial statement. Who would have thought? The other one I posted, I look forward to the day when it's no longer acceptable to censor and ridicule parents of vaccine-injured children. You wouldn't believe the hate that provoked, okay? Those parents are liars. They are absolutely misrepresenting what happened. They have no idea what really happened to their children. They're damaging vaccine uptake. They're damaging the credibility of the vaccine industry. Hundreds and hundreds of people making these kinds of comments for these very simple questions. This hate speech appears to originate from a combination of left-leaning political partisans, fake accounts or bots, and avid members of the cult that aggressively advocates that all vaccines are undeniably safe and effective. As has happened in the EU, CDC has suffered from a bureaucratic mission creep. Exacerbated by this cult-like culture of unquestioning vaccine advocacy, combined with a perverse utilitarian bioethical framework based on the thesis, the ends justify the means.